Hi everyone, Brian Lewis here with KidneyCan. It's my pleasure to welcome you back to another joint edition of the National Kidney Foundation and KidneyCan's NKF Live series. And today we'll be discussing the topic of preserving kidney health as it relates to kidney cancer. My guests today include Dr. Matthew Abramson, Assistant Professor, Division of Nephrology, Icahn School of Medicine at Mount Sinai Hospital here in New York City, who specializes in working with kidney disease patients. Welcome, Dr. Abramson.
Thank you for having me, Brian.
Looking forward to our discussion. Also with us today is Glenn Sykes. Glenn's a person living with kidney cancer. He's retired from the University of Chicago Booth School of Business, where he most recently was the Dean of Students for MBA programs. And he's graciously agreed to share his experience with kidney cancer with us. Welcome, Glenn.
Thanks, Brian. It's great to be here.
Great, great. Well, let's dive right into some of these questions. So I've got to ask a question as a kidney cancer patient. What exactly is nephrology?
Nephrology is the specialty of kidney function. As a nephrologist, my main goal is to maintain a patient's kidney health by focusing on preserving its function.
Preserving its function, okay. So Glenn, you and I both have had nephrectomies. Why don't you tell us a little bit about your story and we can tie that into nephrology here.
Yeah, sure. I had a nephrectomy in 2010. I was 51 years old. That cured my cancer for about 4.5 years. I became metastatic in June of 2015. Since that time, I've had both systemic therapies, 2 kinds of systemic therapies, and some localized targeted therapies that has, for the most part, kept my cancer in check.
Great, great. And for the audience out there, we always throw new words at some people, so let's explain a couple of words. First of all, a nephrectomy is when they remove a kidney, and systemic therapy is when you have
take medicines that's treating all of your whole body versus a localized treatment, which is a specific treatment, for example, radiation, that's targeted on a particular tumor site.
Great, great. So when we're thinking about this from a kidney cancer perspective and we're trying to preserve kidney health, we only have one kidney left, so we're thinking about that all the time. But when we're first, sort of introduced to the medical world with a diagnosis, we usually have seen a urologist or an oncologist. So talk to us a little bit, and I'll ask both of you, talk to us a little bit about nephrology, urology, and oncology. You want to try that one, Dr. Abrams?
Sure. So as I said, a nephrologist deals with the kidney function and maintaining kidney health from the function perspective. A urologist is actually a surgical specialist. Urology is a surgical specialist, and their main focus is to remove the tumor when the tumor is removable. And the medical oncologist is a medical specialist that deals with giving medications to treat the cancer itself. So while there are very different specialties, we do work very closely together because the patient is our main focus.
Okay, and so if you're thinking about, if you're at home right now and you've seen a urologist or an oncologist, do they need to run out and make an appointment with a nephrologist?
Absolutely not. Risk factors for needing, if you need to see a nephrologist, usually it's related to the fact that you may have underlying kidney disease before you start treatment or before you have surgery, or you have other risk factors that maybe your doctor has identified, including high blood pressure requiring multiple medications, or diabetes with protein in the urine. These would be reasons why it may be reasonable to see a nephrologist prior to your treatments, but not everybody needs to see a nephrologist.
Okay.
And Brian, I was going to say that I have started with a urological surgeon to remove my kidney and then move my care over to a medical oncologist, but I have not ever seen a nephrologist. And counter to what you said originally, I did think a lot about that one kidney and having that one kidney really intensely for the first few months of my after having my other kidney removed. Since then, I think I've dialed that back. I don't think a lot about that other kidney. Maybe I should. Maybe I'm going to find out tonight. I should be thinking about it more.
Yeah, so, okay, that's the topic on my mind. I have one kidney left. What can I do to preserve it? So let's talk a little bit about that. Do you think intake of certain nutrients or water, any comments on that can help those folks out there that are thinking about this?
Sure. Well, let me preface by saying that many patients live with one kidney and they live a completely normal life with a normal kidney function by lab work. And those include patients who were just born with one kidney, and those include with patients who donate a kidney, and they live completely fine with just one kidney. So really, it should not be just having one kidney removed and only having one kidney remaining should not be a fear in and of itself. Dietary modifications, fluid intake changes, supplements, these are very important topics. From a kidney perspective, it really depends on whether or not you have kidney disease, which will make a difference in how it would be decided what kind of diet fits you. If you don't have any kidney function issues at the start, there's really no major dietary changes that you need to follow, aside from what is recommended based on the National Kidney Foundation, American Heart Association related sodium intake. That may play a role because many patients after removal of one kidney may go on to develop hypertension, or those with pre-existing hypertension may predispose them to worsening hypertension. So for pretty much all patients, I would recommend a sodium restriction related to what is recommended by the American Heart Association.
Okay. So we're on this theme of we've got one kidney, but we're perfectly sort of functioning fine. Don't have to be overly concerned about it. But we were talking about earlier when someone goes to see their doctor, or in our case, follow up with an oncologist. A lot of times they're looking at where the cancer was or is, and they're not so concerned about the remaining kidney. Talk to us a little bit about that, about, should we be monitoring anything at home? Should we be asking questions about our remaining kidney?
Yes, always ask questions. That's one of the most important things to take from this discussion today. Don't ever take anything for face value. If you look at your lab work, see if there's anything abnormal, see if there's anything you'd like to discuss aside from the cancer with your cancer specialist. If you know your kidney function is mildly abnormal, if you've been told that before, if your oncologist says it's mildly abnormal, it may be reasonable to consider seeing a nephrologist just to see if there's anything else that can be done to improve your kidney health. If you haven't had your urine tested in the recent time for things in the urine that may predispose you to kidney dysfunction, it may be worthwhile to ask your urologist or your medical oncologist, even your primary care doctor, maybe it's time to just check my urine to make sure I'm not leaking things out that shouldn't be leaking out.
Okay,
one of those would be like protein in the urine.
Right. Yeah, and one of the questions I had probably is, how will the kidney tell you that something's wrong? What are the tests? We all, as cancer patients, we're getting tested all the time, getting stuck with certain things. How does my cancer tell me that something's not right?
Yeah, that's a great question. Reduced kidney function may be asymptomatic, and it is usually asymptomatic. Some red flags, which you may or may not recognize, that you should bring up with your doctor is, number one, if you notice your urine is looking frothy or foamy, like soap suds, that could be a sign that there's protein leaking into the urine, which can happen after surgical removal of the kidney. That would be a sign that the remaining kidney may be under excess stress, and that can easily be screened for with a urine test.
Okay, so when we get, at least as a layperson, gets my blood tests or urine tests back, there's a lot of acronyms, a lot of shortened phraseology. I think creatinine is a big one that we're supposed to be keeping track of. EGFR. I'm hearing potassium. So can you tell us a little bit about creatinine and EGFR?
Yeah, so creatinine is a ubiquitous test in that pretty much every time you get your blood drawn by any doctor, a creatinine will be checked. Creatinine is an indirect measure of kidney function. It is a breakdown product of muscle similar to creatine, and those with more muscle mass may have a higher creatinine. Those that have a lesser muscle mass may have a lower creatinine. There's a normal range. That's why there's a normal range. And we take that creatinine value and we put it into a calculator, and it gives us an estimate of kidney function. It's not perfect, but that is what we go on based. That's the most common test we use to kind of gauge the risk for patients with kidney disease.
Is creatinine, and EGFR, I don't know what that stands for.
Yeah, EGFR is estimated glomerular filtration rate. That's a big word, and all it means is how much is the kidney working. I can almost think of it as like a percentage. Is your kidney working 100%, 50%, 40%, so on and so forth. So if you put your creatinine value into one of those calculators, it gives you an approximate percentage of kidney function, and that's a useful test for your oncologist. And also, and if it reaches a certain percentage or less, then that would be a good time to be referred to a nephrologist.
Okay, so it's not necessary for everybody to run out and get these tests right away, but as you're having them, you just keep an eye on what the normal ranges are and make sure that you're falling within those.
Absolutely, yeah. And if you ever have any questions, if you see abnormal lab work, please ask your doctors, and they'll answer to this to the best of their ability.
Glenn, any home monitoring that you're doing, or any follow through on your tests?
Well, I'm not doing any home monitoring with regard to my kidney health. I get labs once a month, so I'm able to keep on top of the things we just spoke about. I am a little curious about the urine test, because that isn't something I get done on a regular basis. I happen to have it done through an annual physical process. I think it's important, even as a kidney cancer patient, to make sure that I have a relationship with a primary care physician, get a physical. But what's the frequency you think I should be having a urine test?
I think if you associate them with your physicals, that's probably enough. For screening purposes, probably once a year is probably enough without a history of it.
Yes.
If you have a history of protein in the urine, it should be done more frequently.
Okay.
Okay, so let's shift a little bit to those of us that have to be monitored and have to have scans on a variety of bases depending on where you are in your journey. There's a lot of fear out there about taking contrast in advance of your scan. Can you talk about that in terms of its impact on your remaining kidney?
Sure. So there are different types of contrasts, actually. Some contrasts are not toxic to the kidney. Other contrasts may be toxic to the kidney. The ones that are actually not toxic to the kidney are oral contrast, so if you take contrast by mouth, or if you get a contrast with an MRI study. There may be restrictions for the MRI study contrast if your kidney function is very low, but that doesn't actually affect the kidney. It can have other systemic effects on the other organ systems. So the one that you really have to talk about is the iodine contrast, which you usually get with a CT scan or an angiogram for your heart. With a normal kidney function by your estimated GFR or your creatinine, the risk of having issues with the contrast from a CT scan is minimal. If your kidney function is very low, you need to discuss this with your provider and weigh the risks and the benefits of doing the scan. Sometimes the scan with the iodine and the CT is really needed to see where the cancer is. So that's a discussion we had with your doctor.
And I've also heard there's a number or a few new contrasts that are coming out or have come out. Is that the case? Are you familiar with?
Yeah. So I think over the past decade or so, the iodine contrast used with CAT scans have become much less toxic to the kidney because the molecules themselves are much smaller, and they just have been shown to be less toxic. There's still maybe a very minimal risk, and a mild risk if you have advanced kidney disease. But aside from that, I wouldn't worry about it. Even with a solitary kidney and normal function, you should not have a problem getting the iodine contrast.
So the advice that I've been given as I'm leaving, usually the CAT scan, is drink a ton of water today and tomorrow and flush your system. That sounds pretty good advice.
For iodine scan, that's a reasonable plan, unless your doctor has told you otherwise to avoid a lot of water, because that would be a different situation. But in general, that's reasonable.
And,
yes.
and the contrast then is just flushed out of your system over a few days or something.
Yeah, it should be flushed out within one or 2 days.
Okay, got it. So on that topic of sort of getting scans and then afterwards and then sort of getting back to some less anxiety around scans, are there certain dietary restrictions or diet things that you take part in, Glenn, to keep track of things?
Other than the things that we talked about already, I think initially when I was first diagnosed, I had a lot of anxiety about everything, of course, and I think I was worried a lot about diet. For example, on sodium, which we talked about, I wanted like no sodium in my diet, which is nearly impossible and makes you sort of a miserable individual. I've since, scaled back that and thought about what's all the good advice about a diet. What should a diet have? What should a balanced diet have? What things should you be mindful of? And that's what I try to keep in mind now. And that's widely available, that information. And you can enjoy food, all kinds of food. And you should just think about the advice that's available from the American Heart Association, the National Kidney Foundation, about what makes a diet a good diet.
Yeah, one of the pieces of advice one of my doctors gave me was, I asked him the same question: what should I stay away from? What should I add more of? And the general theme was moderation.
Yes.
Would you agree with that?
Absolutely. Moderation is important for all aspects of patients with kidney disease and also cancer patients. You never don't. I would always recommend never to do one extreme or another, because then you'll have the opposite will eventually you'll eventually go the opposite direction.
Yeah.
Right. So, as far as water intake, is there any recommended amounts? I probably should know this, but I don't know. Are there? My wife tells me to fill up my water bottle and drink 2 of them a day at least, and I try to do that. Any other advice?
So I would say, with the caveat to immediate post-surgical recommendations, I always leave up to the surgeon. However, for long-term care of your kidneys, the best amount of water or fluids to drink is to thirst. Overhydrating, overdrinking doesn't actually help the kidneys. It can actually cause other problems. So I always recommend to drink to thirst. There are exceptions to that, but in general, that's usually my recommendation.
So if you're thirsty, get some water.
Yes.
And just don't overdo it.
And just to clarify that further, try to avoid becoming excessively thirsty. Make sure you maintain the hydration that your body's telling you need.
Okay. Let's listen to yourself there a little bit. Again, moderation theme. Anything changed in your diet or anything specific that's gone on since you've been diagnosed, Glenn?
There's one thing that I would say that I have a heightened awareness of because of only having one kidney is sodium. I do think about sodium a lot and think about the intake I have of sodium. You think about moderation. I think that's an important thing. I also keep in mind that even moderation, even in moderation, sometimes you just can't. You have to let go of it and enjoy whatever's in front of you. But that's probably the single thing that I think about the most is sodium intake.
Two themes that I've heard quite a few times, either online or through talking to folks, is sugar intake, and then there's supplements. So I want to talk on sugar for just a second. Any again, just the moderation theme applies here. Like when it's Christmas time or the holidays, there's cookies and cakes and everything out. Just moderation, or you have to stay away from them entirely?
So for sugar, that's an interesting question. Sugar to the kidney is kind of empty calories, I would say. If you're not a diabetic, you do not need to restrict your sugar specifically. Having diabetes is a completely different discussion, and a lot of patients with cancer do have diabetes. However, patients without diabetes, moderation in sugar is fine. Obviously for holidays, you can splurge a little bit. But the calories from sugar is kind of empty. It's important to again have a well-balanced diet, including adequate protein, adequate greens, vegetables, etc. So sugar, you can have some, of course, but
okay.
Yeah.
Again, back to moderation. So we mentioned, or I mentioned supplements. So that's always a controversial topic. Maybe we should start with defining what exactly are supplements.
Right. So you want to try this one, Glenn?
It is a controversial topic. I think there's a lot of confusion when people hear the word supplements, doctors hear the word supplements. You think about maybe there's something you take every morning, open a bottle and take a pill, for example. And I think there are vitamins, and then there are herbal supplements. And I think there's a big distinction between the two, even though sometimes they get captioned under supplements. I am, from the beginning, through the advice of a nutritionist, have taken a lot of extra vitamins. to be honest with you, I don't know whether they're doing me any good. I don't believe they're doing me any harm, so I continue to take them, and that's sort of been my philosophy: is that do good and there's no harm, keep taking them.
Well, I want to hear your comment
Yeah.
on supplements. I agree. Supplements, we throw that umbrella term, and there's, I'm sure, quite good vitamins and minerals that we all should probably be taking as supplements. And then there are these other, quote, supplements that might be a little challenging to the body.
Yeah, I would say that most of my patients with kidney disease do take some form of supplements. But yes, I usually broadly categorize it into vitamins and minerals and herbal supplements.
Yeah.
Vitamins and minerals, first of all, multivitamin is usually advised, and that is a safe supplementation. Other vitamins usually should be advocated based on what your doctor tells you. Some vitamins can be dangerous if they're, the fat-soluble vitamins like A, D, E, and K. They should be minimized unless your doctor tells you otherwise. Now, the water-soluble vitamins like the B and the B vitamins, may not cause harm, but may not be beneficial unless you're lacking them. There's one vitamin I just want to highlight just to be careful with. It's vitamin C, and it's excessive vitamin C. By pill form or even intravenous form, that can actually hurt the kidney, and I would advocate not to use them unless instructed by your doctor. Vitamin C from fruit is actually safe, but the one from supplementation, just be careful with. Now, for herbal supplements, I would be very cautious because, to my knowledge, there really are no specific herbal supplements that protect kidney health or increase kidney function, even if they say so on the bottle. They're not. Most herbal supplements are not approved by the FDA, and they have minimal requirements in what they display in their bottles. If there's a supplement that you really are interested in taking, please discuss this with your physicians, whether it's primary doctor, oncologist, or your nephrologist.
Great, great. Well, let's take some time to look at some of the questions that folks watching have been asking. And I'll remind you that if you have any questions on this subject, please post them in the comments section, and we'll do our best to answer as many as we can. And if we run out of time, please know that all your questions will be addressed on the NKF or Kidney Can's Facebook pages after the program. So here's a question from one member of the audience. What types of health conditions should one be aware of that could occur during or after kidney cancer treatment? It's pretty broad.
Yeah, that's a great question. And I think, first of all, before treatment, it's really important to know and understand your other comorbid conditions, and that includes your high blood pressure and your diabetes. And if you have chronic kidney disease at your baseline. The high blood pressure usually is affected during and after treatment. Oftentimes, when you have one kidney removed and you only have one kidney remaining, you may end up developing new onset high blood pressure or worsening high blood pressure, and that usually requires some medication changes. So that's something really important to know. Diabetes may not worsen during or after your kidney removal or the treatments thereafter. But your diabetes should be well controlled, or to the best of your ability and to your physician's ability, to prevent other to prevent your kidneys from worsening over time. So those are the main things to be mindful of.
Something on that note. So on high blood pressure, we all get our blood pressure taken every time we go to the doctor. We should be monitoring it over time. What would you say is the ratio of increase that should start setting off some alarms or maybe causing you to ask some more questions?
Yeah, that's a great question. This has not been thoroughly studied in the cancer population. However, my guidance is to follow the most recent guidelines from the American Heart Association and National Kidney Foundation to maintain your blood pressure as close to normal as possible, before, during, and after your treatment for kidney cancer. Whether that's 120 over 80, as close to 120 over 80 as possible. That would be my recommendation. And like I said, a lot of times your blood pressure will go up during and after your treatment, and you probably will need medication changes. Yeah.
So is there a number for the audience, like if we use the 120/80 scenario, if it goes up to 130, 140, 150, is there a number in there where you start, or the 80 goes, in the different direction? Is there a number that should be a trigger for anybody, or is that too specific for everybody's case? Each case is different.
That's probably too specific for each case is different. However, I would say that just paying closer attention to your blood pressure during and after your treatments, whether it's with directly in your physician's office or checking your blood pressure at home, these are other ways to kind of monitor your blood pressure over time. One elevated reading may not give you an accurate picture. It's more of the trend.
Okay. And one of the things, Glenn, I'm picking up on is, we talked about at the beginning of the show, nephrology, urology, oncology, yet we also see those oncologists on a regular basis, but then we have our regular primary care doctor, and are they all getting the same information, or are you sharing the information? And it sounds like you didn't get a certain test with one of them, maybe?
Yeah, so that's a good point, and I think that related exactly to this question is it's important to keep in mind, even as cancer patients, lots of other things can go wrong with us. And the medical oncologist is going to be really focused on our cancer. It's important, I think, in my case, I thought it was important to continue a relationship with my primary care physician, have an annual physical, keep monitoring all the other things you'd want to do, even without the cancer, because things can go wrong. My medical oncologist and my physician do work for the same institution, but I don't know that there's a lot of talking between the two of them. I think I serve that role as a bridge between the two of them.
Sounds like being your own advocate is really important. In
So important.
Do you find, doctor, that when you have patients that are like well versed in all of what's going on with them, that they're better patients, or do you have any advice for patients out there when they're coming to see their doctor for the first or follow-up visits to advocate for themselves?
That's a great question. I think that patients, either the patient or a family member, needs to be an advocate for that patient. Just like Glenn said, many doctors, they focus on their one specialty, and sometimes they forget to look at the patient as a whole. So it's really important to have an advocate to kind of help how the patient and the provider look at the patient as a whole. Ask questions. If you see an abnormal test and you don't understand it, ask what it means. Ask if it's important. And if the doctor you're speaking with doesn't have an answer, ask them who can give them that answer.
Okay, I love it. I love it. So for those folks at home, don't want to alarm anyone, but if they were, by themselves quite a bit or at home with family, and what might prompt them to need to seek out medical help in a situation I'm not phrasing this really well, but at what point does something raise to the level of needing to reach out to their doctor?
So from the kidney health perspective, if you notice that your urine has changed, where you see it very frothy or foamy, and that's very new, or you see that your urine, the amount of urine you're making is much less than usual, or you're feeling just very unwell, lightheaded, or dizzy, or if your blood pressure has major swings, either very low or very high, these should prompt you urgently to reach out to your physicians.
Okay. Do you advise patients to keep home notes and memorandum, or Glenn, do you do any kind of home monitoring?
It's on that long list of things that I should be doing that I don't. So I actually don't.
So you just sort of keep in tune with your body and
Yeah, I'm convincing myself that I'll remember all these things, but it doesn't happen that way.
Okay, fair enough. All right. So we're starting to get a little bit close on time here. I think we've got time for maybe one or two more questions. Is there any nugget that you want to share with the audience before we sign off here?
Oh, wow. Okay. Well, I think the nugget that I think has come through a lot on this, of course, when we have, as cancer patients, have had the traumatic diagnosis of a cancer, it can play, I think, games on your mind. Your anxiety level can go through the roof at sometimes. But I think you need to figure out how you can step back from that. Think about, for example, common sense things with regard to your diet, what things you should be monitoring for. Try not to drive yourself crazy. I think I did a lot of driving myself crazy in the beginning and driving the people around me crazy. And I think what I've learned in the 12 years is that that wasn't a good use of my energy. Sort of step back, take care, remember what things are good health. I think we all know those things. Some of it's common sense, some of it's moderation. And those are the best things that I think you can do.
Dr. Abramson, any nuggets for the audience?
Yeah. So kidney cancer does not mean you have a problem with your kidney function. It does not mean you have something called chronic kidney disease or kidney failure. They're very distinct entities, but they can occur together. If you do develop impaired kidney function, there are doctors that can help you along that path.
Great. Well, unfortunately, we've run out of time. And in case we didn't get around to answering your question today, please check back on the National Kidney Foundation and Kidney Can's Facebook pages, and we'll be posting the answers throughout the coming days. I also want to take a moment to let you know about the NKF Patient Network. And this network was developed to help people with their kidney health. So you can learn more and register by visiting nkfpatientnetwork.org. And I'd like to thank our sponsors for their generous support in making this program and the other programs possible. Really appreciate that. And especially like to thank Glenn and Dr. Abramson for joining us today and helping us to make sense of what I know can be a very difficult subject for so many people. So thank you both.
Thank you, Brian.
Thank you.
Thanks for having
Great.
us.
On behalf of the National Kidney Foundation and Kidney Can, I'd like to wish you all a great 2023 and good health. Thank you both.